When we see patients after massive weight loss, either through surgery or on their own, they've done all the hard work. They've done exercise programs, diet modification. We see them and they feel tremendous. So the last part is to trim unwanted skin, tighten muscle where it needs to be. And at the end of that, they look great, they feel great, and that's really rewarding.
Unfortunately, we often get done with the weight loss and we go, I've lost all this weight, I feel better, I'm healthier. But I look in the mirror and it's the butt part that we have to take care of. It's the, I look in the mirror, I'm healthier, I just don't like this appearance still. And that's where we come in with body contouring.
I think it's that education that sets us apart. We spend an hour to an hour and a half with every one of the patients who comes to talk about body contouring, just with the doctor, one-on-one. And so at the end of that period of time, I like to say that patients who leave here are real experts in the topic, and you're going to make a great choice after that.
It's our job to look at you, and it's our job to help you decide what parts of the excess skin and the damage that the weight gain has done to you can we repair. That's not frivolous. That's helping you recover from having been massively overweight.
Typically after bariatric surgery, we're going to be removing excess skin in one location or another. It's typically sore afterward, and so you have a recovery time of 2 or 3 weeks as you're getting back to your normal activities. And so a lot of people say, well, if I have to be sore in one area, well then how about I could be sore in another area at the same time? And in most cases that's possible. It's just that we don't want them sore in every area. They don't always tell you what happens to the body after you have kids. Like that's not in the manual. So I think that a lot of women are disappointed about their appearance after they've had kids, after they've breastfed, that sort of thing. So there are options for them. Tummy tuck, breast lift, those are great operations, particularly for young, healthy people. And we see a lot of those folks. So again, education is the key. There are a lot of different options for what you can do, and we can usually come up with something that leaves you feeling really tremendous and back into two-piece suit, that sort of thing, really quickly.
Weight loss results in predictable patterns of excess, if you will. And we always think of it as excess. We think of it as excess skin hanging here, a little bit of excess fat that's left over, but sometimes it's not an excess. Sometimes it's a lack, because you would not believe how many patients come in after massive weight loss and say, I don't know where my butt went, and I don't know where my breasts went. And so sometimes we have to add things in instead of take things away in contouring of your body after weight loss.
My philosophy on body contouring surgery after weight loss has a lot to do with what you want. And so some patients have hanging skin in a lot of locations, but one specific area bothers them the most. Well, great, then we'll target that. If not, if there are several things, then we'll map out a plan and I'll say, here's the best thing for you. Tell me what you want to do first, second, third. And sometimes it involves a couple procedures, but we'll get you there. And there are patients that have been with us for years. They come back until they get to be just where they want to be.